We will talk about a very important inherited liver disease, which is the hemochromatosis. Hemochromatosis actually total body iron is increased and excess iron is deposited and damages several organs, including the liver, which is the most important. It may be primary or secondary or iatrogenic or dietary iron overload or other rare diseases. Inherited hemochromatosis, which is the autosomal recessive condition that results in the increased absorption of the dietary iron, such that the total body iron may reach 20 to 60 gram normally, which is 4 gram. Approximately 90% of the patients have a single point mutations. Iron loss in the menstruation and pregnancy may delay the onset in females. We will talk about the clinical feature. The clinical feature is actually the important organs involved are the liver, pancreatic islets, endocrine glands, joints, and the heart. Symptomatic disease usually presents in men over the age of 40 and older, with the features of cirrhosis, especially the hepatomegaly, diabetes, or the heart failure. Fatigue and arthropathy are the early symptoms. Leaden gray skin pigmentation because of the excess melanin occurs, especially in the exposed part, which is the axilla, groin, and the genitalia. Bronze diabetes, impotence, loss of libido, testicular atrophy, and arthritis are the common. Cardiac failure or dysrhythmia may complicate heart muscle disease. Going for the investigations, first we will check the serum ferritin, which greatly increased. Plasma iron also get increased with the saturated plasma iron binding capacity. The third investigation point is the liver biopsy. Used to confirm the diagnosis, the iron content of the liver can be measured directly. And genetic testing can also be performed, identifies the common mutations. Now we'll talk about the management and the prognosis. Weekly venesection or 500 ml blood, which contains almost 250 mg iron, is performed until the serum iron is normal. This may take up to 2 years or more. Therefore, venesection is continued as required to keep the serum ferritin below 50 microgram per liter. Liver and the cardiac problems improve after iron removal, but the diabetes does not resolve. First degree relatives should be screened. Pre-cirrhotic patients with the hepatocyte with the HCHHC, which is the hemochromatosis, have a normal life expectancy, and three-quarters of the cirrhotic patients are alive 5 years after the diagnosis. Screening for the hepatocellular carcinoma is mandatory because this affects about one third of the patient with the cirrhosis, irrespective of the therapy. So, this was all about the primary hemochromatosis, which is the inherited liver disease.